In Module 2, we briefly reviewed the social determinants of health in relation to a motivational interviewing type of approach, and for you all to really understand where your patients are coming from. So this module, in this lecture, we're really going to dive into what social determinants are, the definition, and the different aspects of determinants of health for the patients that you'll be serving. So right now I think there's kind of a buzz going on in community health as it relates to social determinants of health. I'm seeing news articles and blogs about various community health paramedicine programs that are really diving into social determinants of health. So it's really important that you guys have a baseline knowledge of, and if you don't already, what social determinants of health means and how you guys can implement that and analyze it in your programs. So the World Health Organization defines social determinants of health as the conditions in which people are born, in which people grow, the conditions in which they live, their work, and their age. And further, these determinants are shaped by either wealth distribution of populations, the resources that are and are not available to them, and the individuals in a community. During this course, I'm sure you all have heard about a community needs assessment or an individual patient needs assessment. Now remember, those are two different types of assessments. When we talk about a community needs assessment, this is where you really dig in as a community where you live and work to determine what are the gaps in the community, what services are provided, what resources are provided, but also looking at what services and what resources are not provided by doing that needs assessment, and then from there figuring out, okay, how can we help to fill those gaps? The same applies for a patient needs assessment. It's the paramedic having this ability to go into a patient's home and identifying any issues, social issues, healthcare issues that ultimately play a role in not only the health of the patient, but overall health of the community in which that patient lives. When you go into these patients' homes, I think what you're going to realize is there are going to be gaps, not necessarily associated with, from a clinical perspective or with the patient's health, but you guys are going to go in and realize that some of the patients that you serve have social issues. So when we talk about social issues that relate to health, really can range from culturally guided behavior practices that may impact a patient's diet or exercise, or a socioeconomic constraints that may exist, such as poverty. Therefore, the reason that we really cover social determinants of health is for a couple reasons, is allowing you all as paramedics to be able to research and identify the social aspects of an individual patient's and the community's health, in order to better prepare and assist in developing initiatives to address or overcome these social issues that your patients may have. Additionally, addressing one social determinant what we have found, can have a somewhat domino effect. So for example, when a person finds employment, it not only increases their income, but it also may allow them better access to health care. And when they have better access to health care, it may therefore improve their ability to take control of their own health and maybe the health of their family. And when we talk about social determinants of health as it's applicable in the community health paramedicine world, it's really something that needs to be addressed early on during your encounters with the patients that you serve. So traditionally here at MedStar, our mobile health paramedics, we do our initial evaluation visit, and then we go in and do an initial in-home visits, and that's where we go in and we do that patient needs assessment, and we really identify gaps in the patient's social or healthcare. So it's important to identify these really early on, because what we do is once we identify gaps, we then turn those into opportunities. So for our patients that have a couple gaps, we turn them into goals. So the point of that is, if we're seeing a patient for 30 days, 60 days, 90 days, we know, for example, if we have a patient that we identify who frequently contacts EMS for chronic health issues, we know that one of our main goals is to help reduce that EMS utilization. Well, knowing that, what are the causes of that patient contacting EMS? And maybe one of the biggest things is maybe they have diabetes, but they don't understand their disease process. Okay, perfect. Not perfect, but you know what I'm saying is, okay, this patient has diabetes, they don't understand that disease process. Let's turn that into, that's a gap, we're going to turn that into a goal. Therefore, for the next 30 days, we're going to slowly educate this patient on their disease process. And so the chart you see up here for our mobile health programs are determinants of health that our mobile health paramedics have identified and addressed, and this is data that we've aggregated over the last 2 years. And further, you'll see that it's broken down by health services. So when we talk about health services, we talk about patients that have gaps in not having a primary care provider or a specialist, or maybe somebody who needs physical therapy, or somebody who needs home health services or palliative care services. Physical determinants, we break those down. Is this a fall risk patient? Do they have carbon monoxide that they need the monitors for? So these are physical things that we have seen in their home that we need to find resources for these patients out in the community. Additionally, we look at individual behaviors. So are we seeing a patient that smokes, that drinks? So do we need to refer them to substance abuse resources, to tobacco cessation programs and things like that? So you'll see that a good majority of the determinants of health that we identify and address have to do with individual behavior. And I went over the domains with you. What we also look at is this graph represents domain breakdown. I know that there's a lot of things here, from wound care to referrals to adult protective services, housing, transportation, things like that. But if you'll note, the two highest pie slices here have to do with patient education, or an understanding of disease process, and therefore providing patient education. The second highest domain we also identify as medication compliance. So why I go over this is something that our mobile health paramedics are going in and assessing, documenting, and what we do on a regular basis is we go in and we look at this data as it relates to social determinants of health to see, are we identifying appropriately? If we're not, then let's look at that, and do we need to make some process changes? Are we maybe identifying that patients have gaps, but are we appropriately navigating those resources? And if we aren't, what's the reason why? What are the challenges with that? So that's why in Module 1, I really wanted you guys to start focusing on data collection, data analysis, data trends, in order to see if there's some sort of impact that you all can have in your organization and in the community. Traditionally, on a broader level, when we talk about social determinants of health, there are very specific determinants that can affect the community's overall health. And what has been found is that those determinants are related to religion, related to culture, socioeconomic status, age, and relationship status. Knowing that these determinants can have an impact on the overall health of the community, what we find is that a lot of these determinants are kind of intertwined, kind of like a puzzle piece, as you can see in this slide. So when I talk about a puzzle piece, someone's age may relate to their relationship status, or maybe their religion has an effect on culture, maybe relationships has an effect on socio or economic status. When we think of social determinants, we really need to broaden our perspective to encompass any and all social interactions people have with their environment. All of the determinants affecting a person's health, those of social nature, are by far the most fluid. And funny thing is what we're finding is paramedics can have a pretty substantial impact on social factors out in the community. I think part of it is because we have this innate ability to walk into a patient's home, gain that trust and rapport on a pretty quick level, identify gaps, and we also have this ability to be mobile, go out in the community. We identify a gap, you know what I'm going to do? I'm going to just drive myself to that clinic. I'm going to call that physician. I'm going to call that social worker. It's kind of like a challenge accepted in our world. Now let's look into religion. Religion can play an important role in the overall health of a community and of an individual. Remember that a patient's religious beliefs or their practices may impact his or her health either on a positive level, or it may impact their health on a negative level. Since the creation of organized religion, some practices and rituals have had positive effects by promoting and maintaining the public's health. For example, Hebrew practices of circumcision reduce the potential for infection by human immunodeficiency virus and other sexually transmitted diseases, according to the CDC. And additionally, go figure with this example, practices of quarantining people with diseases such as leprosy were intended, or COVID-19, were intended to prevent the spread of those diseases to the community. Religious beliefs may play a role in determining when and what types of medical intervention people seek out. Some belief systems have guidelines regarding blood transfusions, contraception, and vaccines. Some belief systems see prayer as the most effective means of healing and encourage their followers to seek it before or along with any type of medical intervention. In our society, it's every person's right to abide by his or her own religious convictions, and we have to remember that spiritual care is just as important to some patients as physical care. Religion also affects a person's end-of-life decisions as it relates to palliative care or medical interventions, whether they want medical interventions or they don't. So the community paramedic should be aware of a patient's belief and seek to identify what their effects might be both on the individual's health and on the community's overall health. Now let's dig into culture a bit. Culture practices are also important when examining the determinants that affect a person's and a community's overall health. So culture is defined as the beliefs, customs, and art of a particular society, group, place, or time. Our focus will be on culture as identified in customs. So the cultural environment in which a person lives can influence his or her outlook on life. So think about it in today's society. When food is ever present and easy to access, obesity has become a public health concern. To complicate this unhealthy trend, a person growing up in a culture that places great emphasis on an unrealistic body image, and unobtainably thin waist, for example, may be influenced to make choices that are not healthy, really in an effort to fulfill those cultural expectations. So that relates to maybe anorexia or bulimia. Cultural practices may also include dietary choices. So some cultures cook and prepare foods that are high in sodium, maybe high in sugar, or high in saturated fats, which may not be the best option for our congestive heart failure population, for our diabetic population. Excessive amounts of these elements in food have been linked to increased health problems ranging from high blood pressure to cardiovascular diseases. Some cultures have a history of healthy food preparation and choices. So, Mediterranean diets often have at their centers food olive oil, nuts, and other foods that reduce inflammation and benefits the body. So, think about on both aspects. There are some positive attributes and some negative attributes as it relates to culture and food preparation. Culture may also influence a person's willingness to seek medical attention. If someone comes from a family that has historically seen healthcare as something that only really sick people need, so an EMS, right? We don't call 911, right? We don't go to the hospital unless I'm not breathing and I don't have a pulse. So think about it from a cultural perspective. He or she may wait until symptoms become unbearable before seeking medical attention. We know nothing of that sort right now in our world of all things COVID and pandemic. Other people may have grown up in families that highly value health maintenance and checkup. Culture influences the way we make decisions. So our cultural environment often dictates to us which choices are good and which choices are bad in the eyes of society. So think about it. A community paramedic who listens to the patient and seeks to identify the cultural influences affecting him or her will have greater success in not only communicating but working with the patients. As healthcare professionals, it's our job to give patients the best information possible to help them make the most well-informed decisions. For example, you all as community paramedics may have to explain to a diabetic that although his father lived to 80 without going to a doctor, hereditary may only play a small part in each person's unique health, and therefore it may be important for that patient to go to a doctor earlier than 80 years old. Social and economic status is the most commonly discussed social factor affecting a person's health. Socioeconomic status refers to a person's financial capacity, their education level, and or their work status. Certain factors as it relates to socioeconomics that can have an effect on a person's health include social exclusion, the housing and water supply that they have, education, employment, and transportation. And I've heard often in courses that I've done and the patients that we serve in our program, transportation is a huge gap in the community. Okay, so let's talk a little bit about social exclusion. So this is measured more by subjective means than by really hard data. So it's a phenomenon in which a person or group is excluded from social interaction with those in the community. When social exclusion results from racial, ethnic, or cultural discrimination, people may not be able to access health care. Social margin may exist where people who are in the fringes of the social system and often have an unequal access to health care. So commonly, people who are more likely to be marginalized are your mental health population, your homeless population, or individuals with a history in the penal system. Social exclusion can also be the result of absolute or relative poverty. So absolute poverty is the lack of basic material necessities for life, including healthcare. Relative poverty living is an example of folks living in less than 60% of the national median income. So people who are impoverished may be unable to access even free community health services due to a lack of transportation, odd working hours due to multiple jobs, or an inability to find or coordinate childcare. Social exclusion, if unchecked or unchanged, ultimately leads to an unequal distribution of, or at least unequal access to, healthcare and other resources. It truly can cost lives. So people at the lower end of the social gradient are often unable to access basic healthcare services due to financial issues. Thus, those lower on the social gradient are often at higher risk of life-threatening diseases, higher risk of injury, or other health-related issues. The decline in health of a person who remains on the lower end of the gradient is often exponential. For example, if a person with high blood pressure is unable to access resources to control it, it can easily compound to the point of a stroke or death. So, by assisting patients at the lower end of the gradient and accessing proper healthcare services, you all, as the community paramedic, could potentially have a larger effect not only on the patient's short-term health, but also in their long-term health. So, when we talk about housing on a very simplistic level, it is a shelter and a form of protection against environmental elements. Adequate housing impacts more than just basic comfort. It can also have ramifications on a person's health. So what exactly could those ramifications be? Well, housing provides access to many of the basic services needed to ensure proper health. So having access to clean water. If you didn't have access to clean water, you're more at risk to be exposed to diseases, to infection. Sanitation, having the ability to have waste disposal, and just having an overall ability to have shelter. Here in Texas, it's hot in the summertime, so we get a lot of heat exposure related injuries, and it's cold in the wintertime. And not having shelter, our calls dramatically increase during our weather extremes. So talking about clean water, it is a very essential component for proper health and hygiene, more specifically for sanitation, proper food preparation. So I live out in the country and we have a septic system, and when that thing is not working, it is very detrimental for my family of 6. No showers, no using the toilet, I can't do the dishes, there's no laundry, we're at risk of not providing water for our animals. It's a huge domino effect. So I think we often take for granted our access to water. Improper hygiene can lead to increased rates of infection and other health related issues such as the flu, staph infections, or common colds. And as it relates to water, improper waste disposal can create a breeding ground for rodents and accumulation of toxic or hazardous substances. Contaminants can easily enter into the water system and create a higher risk for the general population to contract diarrhea-causing illnesses, cancer, and parasites. So what I found was interesting was a survey that was done by the Census Bureau that showed over 630,000 households, and that equates to 1.6 million Americans that are living in housing with inadequate or no access to indoor plumbing or running water. Okay, so now that we've dug into some of these determinants and these domains, let's talk about the home visit environment. So the home visit assessment is not a mechanical inspection of the home, right? You're not going in there with a hard hat and a checklist. It's designed to focus on common causes of injury, such as trip hazards that may be present, any kitchen safety issues. Oftentimes we go into patients' homes that don't have electricity or gas, or electricity, let's say for example, but they're using their stove to heat up their house, right? Definitely a hazard that we need to address. Adequate lighting inside and outside of the house. Maybe there's a gap with in the bathroom. Is there a need for grab bars or lift handles? So during the first home visit or second home visit for some programs, your role is to evaluate the home setting to identify items that can be immediately corrected without the need for any additional resources. So homes with large amounts of dust, mold, lead paint, cockroaches, and rodents can create environments that can exacerbate health issues in people with chronic respiratory diseases such as your asthma and bronchitis population. Now, let's be reasonable though. If you go into my home, you're probably going to find a little bit of dust. So this kind of as it relates to just more extreme cases, but it's important that you all are looking for these type of things. All right, so education. We talk about it often. I've heard from several agencies that education is a huge gap in their community. So it can be an important contributor to a person's health and well-being. What education does is it equips people to be involved in various productive activities in society. So those with a high school diploma may have a much greater chance of being employed than those who do not complete high school. Those who continue on to obtain an undergraduate and postgraduate education tend to obtain higher paying jobs, which can lead to obtaining employee health insurance or the ability to purchase private health insurance. So not only you guys providing education, but this really relates to the education of the patients, what education that they have. So education also empowers people with critical thinking skills, enables them to make better choices, specifically in regard to their health. Increased access to education has been associated with longer life expectancy, improved health, quality of life, and healthy promoting behaviors. I think it's important to note that good health education can be just as important as good general education. Even people at the lower end of the education social gradient can be empowered to take control of their health, or people that may be some of the most stubborn patients that you may encounter. Over time, you may find that they're empowered to take better control. Many diabetic related emergencies that require EMS assistance could potentially be avoided by educating our patients on proper diet, eating schedules, insulin use, and blood glucose meters. I guarantee, and I know many of you are doing that on the 911 side. Now on the community health side, you have this ability to further expand on that. Educating the patient on his or her health condition and ensuring that the patient has received and understood the message can go a long way in improving the patient's health. In regard to employment, it is closely linked to and often associated with the educational social determinant. Being employed can have a positive impact on a person's overall health. People who are employed often find themselves further up on the social ladder, which tends to positively impact overall health conditions. When I was out on maternity leave for a couple months when I had my babies, I couldn't wait for the day to go back to work to just socialize with adults. So for me, work is an outlet really for socialization. Employment can also improve someone's ability of accessing healthcare services and resources. That's if the employee has employer-based healthcare programs. We've talked about how employment can have a positive effect on a person's health. Now let's talk about how a work environment may have, play a larger role in a person's health. So we know that work can often increase stress levels. There may be a commute associated. Think about the length of a person's shift. Do they work 12 hours? Do they work 24 hours? And it's one thing if you work a 24-hour shift, but it's another the demand that's put on you during those 24 hours. Is there time to rest? Talking through, what's somebody's wages? What's their shift schedule? What is their physical work environment? While employment can have both positive and negative effects on a person's health, the effects of unemployment are often purely negative. Unemployed people and their families are at greatly increased risk of premature death, significant health issues, negative feelings about themselves, such as leading to depression or, this negative feelings of not being able to provide for their families. Now let's talk about transportation. When we think of transportation as a determinant of health, we're focusing on the role that transportation plays in affecting an environment. So if you have access to some sort of motorized transportation, whether it's a car, whether it's a motorcycle, whether it's a scooter, it can lead to a decrease in manual transportation, so less walking, right? So walking to the grocery store or to the nearest bus stop to use public transportation increases the level of physical activity in a country where obesity is on the rise. So, here in the United States, our primary mode of transportation is vehicles and motorcycles, right? I went to Copenhagen a few years ago, and their primary mode of transportation is bicycles. There were a million bicycles out there. They even have a lane and they have signals for bicycle riders. And in Copenhagen, Denmark is one of the healthiest countries because I think there are several reasons, but you have a lot more people that are commuting to and from work either by walking, which promotes physical activity, or by riding their bikes. And even the small things add up. So if you have somebody who is just walking a block or two to get to a bus stop or a subway, that's more walking than maybe some of us do when we go from our front door to our car. We get to work and we sit at a desk for 8 hours. So all these, whether large or small physical activity, can play a role in our overall health. Transportation systems also have an effect on the cost of goods and services. For people on a fixed or very limited income, any increase in the cost of goods or services can have a negative effect on their ability to maintain a diet that supports proper health. Increases in food prices have even caused some families with low and mid-level incomes to fall into the poverty end of the social gradient. It's no secret that processed foods are significantly lower in price in comparison to your produce, your fruits, your vegetables, meats. Meats are pretty pricey. When people fall into this end of the social gradient, not only is their health affected due to poor diet, but they also enter into the arena of health risks caused by poverty. So this is a prime example of the extreme fluidity of the social determinants of health. Age can also play an important role in a person's health. At the extreme ends of the age spectrum, people are often dependent upon others to help them access health care. You have such as an older population, or on the flip side, a younger population. I have 2 toddlers that I keep alive every single day because they rely on me for every little thing. So age is often associated with increased risk of disease. Infants, young children, and older adults are at higher risk for infectious diseases, and this is why each year these groups are encouraged to receive vaccinations for certain diseases. As a community health paramedic, keep in mind how age affects your patient's ability to handle illness or injury and access to necessary health care. Ideally, every person has someone on whom he or she can rely on in times of need. Such relationships are very important to a person's health and overall well-being. A person may need someone to drive them to an appointment, drive them to the pharmacy, drive them to the grocery store, assist them with taking their medications, care for them while they recover from a procedure. In the case of marriage or similar shared living situations, two people means 2 incomes, which can determine where a person or family falls on the social gradient. Combined incomes may allow for at least basic services. Employer may offer health insurances to cover family members' needs. So, for example, I'm on my husband's insurance because for transparency reasons, his insurance is a little bit better than my current organization's, and that's okay. But having that benefit, being in that relationship, having that relationship status is beneficial. It's important to note that relationship status extends beyond significant others. So, what does all this mean? As the community paramedic, you must examine the patient's entire social safety net, their family, their friends, their community of faith, right? And so when we're looking at family members, not only immediate family, right? So sons, daughters, mothers, fathers, but also looking at nieces and cousins. I have a lot of family members that really rely on their extended family, aside from their immediate, to help take care of them. Socioecology is a field of study that has emerged in the 1960s and early 1970s, and it focused on the social context of human interactions with their environment. So what it does is it seeks to identify the correlation between the social aspects of the person's environment and the person's overall health status. Data required for this research are collected by the community health paramedic team during both the patient and the community needs assessment. The information from both the patient and the community needs assessment is evaluated and thus used by the community health team to develop a community-wide health program to further address the issues identified during the research and subsequent evaluations. There are other factors that contribute to the community's and the patient's overall health, including geographic dimensions, environmental dimensions, but the social dimensions is often the most fluid and difficult to address. The socio-ecological model, it focuses on 4 overall dimensions of interaction. It really looks at the person as an individual, and remember, one of the biggest domains in the data that we gather is related to the individual. The person's close relationship with others. That's why it's really important that you all know their relationships, who they're close to. The person as a member of the community. It's important to know the type of community that your patients are living in, and societal influences on the person. Talking about the person as an individual, this dimension focuses on the person's environment and their history. This information is collected during the patient needs assessment, or that in-depth in-home assessment, that initial assessment that you're doing. And it allows you all the opportunity to seek information related to the patient's personal situation. Where does the patient fall on the social gradient? What biological factors are present that could affect the person's health? Is there a history of chronic health disease? Do any immediate family members have the same ailment? What about the patient's diet? What type of food is the patient eating? Go into their pantry. Is their diet balanced? Is it not? While exploring these dimensions, you have this ability to inquire about the patient's religious and cultural beliefs. Now, at this level, interventions include educating patients on the conditions that may be impacting their health, their diet, additional preventative measures. So, for example, a patient needs assessment may identify that a patient with diabetes does not understand how blood glucose levels impact their overall health. There you go, opportunity. So the community paramedic may determine that educating the patient on ways to maintain blood glucose levels through proper diet and exercise is the best course of action. Now, digging deeper into a person's relationship with others, this dimension focuses on the person's close interactions, or maybe not so close interactions, with friends and family. This information is collected once again during the patient needs assessment. So what you're looking at are there relationships that are having an effect on that person's overall health? Is it having a positive effect? Is it having a negative effect? Are there unhealthy relationships that are causing undue stress? Are there domineering relationships that are keeping the patient from taking control of his or her own health condition? And keep in mind, religious and cultural beliefs may play a role into that as well. At this level, interventions are more within the realm of counseling, educating the family, empowering the patient to take control of his or her environment. Use your motivational interviewing tools. So, for example, if the patient needs assessment identifies that a family member makes all the health-related decisions for a nonverbal adult patient, You have an opportunity to determine that further that the best course of action is to educate the family member regarding the patient's condition and not necessarily the patient. When we talk about the person as a community member, this dimension focuses on the person's interaction with the larger community. This information is also collected during the patient's needs assessment, in contrast with information about the community. At this level, a deeper exploration can be made into the general environment of school, workplace, or their neighborhood, or other relevant settings with special considerations to how the person relates within these settings. Is the problem isolated to just the patient, or is there a larger communal aspect to the issue? Does the patient have social interactions, or is there evidence of social exclusion? Are there cultural issues within the local community that are having an effect on the patient? Now, at this level, intervention could include you all suggesting changes to further enhance a person's interaction within the community, or finding a new community for the patient to interact with, a new community outlet. For example, a community paramedic may help an older patient get involved in local counseling on aging, organizations and groups, Meals on Wheels, YMCA, things like that. Here's what we found. Society does have an impact and does influence a person. So remember, in motivational interviewing, we talked about influence. Who has come into your life and influenced you? Who's been influential? Who's been non-influential? Well, society can also have a part in that. So this dimension examines the overall societal pressures placed on the person. This information is also something that can be obtained during the patient and the community needs assessment. Culture and stereotypes are the primary subjects addressed at this level. Questions for you all to consider include: what message is society sending this person that could be affecting his or her health, or at least his or her behavior? Are there any societal barriers keeping the person from accessing education or healthcare? In the societal dimension, the only interventions are often sweeping broad spectrum policy changes at the governmental level. So a brief example: utilizing social ecological, the community health team can gain an understanding of the unique role that social determinants play in community health. A community health team can get a broad picture of both the individual and community by evaluating the 4 domains, comparing the data from both patient needs assessment, from your interactions with your patients, to what you're seeing out there in your community. So what you may find is you identify through social ecological research that a portion of your community suffers from chronic high blood pressure, and also engages in cultural dietary practices that involve consuming foods high in sodium. Through this research, maybe there is an opportunity to improve the overall health of a portion of that particular community. So knowing this, you all can act as a liaison with the patient, referring information about the dietary habits of the patient, referring information back to family, back to therefore community and other resources. Environmental determinants. So this is where community health paramedics really have the upper hand, I believe, in the healthcare industry. Remember, when patients leave their doctor's offices, when they leave the hospital, unless they're a mobile clinic or, an in-home, practicing physician, once they leave that office, there's a lot of unknowns. However, you all have this amazing ability to go into these patients' homes and figure out their environmental issues. So another determinant on health is the environment in which a person lives. suggested that 24% of the world's disease issues and 23% of all deaths can be attributed to someone's environment. Environmental determinants are the physical conditions that affect how people live and interact within their communities. Environmental conditions often are related to air quality, water quality that we spoke about, urban degradation, climate change. And overall, environmental determinants can have an immense impact on the health of the population that you may be serving, especially those on the lower end of the social gradient. So think about this. One example cited is the rise of childhood asthma. Prevalence of the disease has greatly increased over the past decade in children ages 1 to 5. Children living in environments with large public transportation systems or near industrial areas with higher concentrations of smoke are at an increased risk for developing asthma. A family that is already struggling to meet its healthcare needs may be overwhelmed by this added strain, and the child's needs may go unmet. Urban degradation has also been shown to have an adverse effect on the health of people and communities. So degrading buildings often pose risks to those around them, such as lead paint or asbesto insulation. You ever go out into your community and there's just this rundown house or this old hospital that has been standing there with nobody in it for years, right? Those can have an effect on the health of that community. So these degrading buildings are often a source of low-cost housing. Thus, they attract families and other people who are lower on the social gradient, exposing them to environmental hazards. And thus, we start the cycle over. And once again, environmental determinants can be assessed during the patient needs assessment and overall during your community needs assessment. You want to pay particularly close attention to the physical community in which a patient lives and ask the following questions. Is there evidence of environmental degradation? What industries are close by? Does the area have a history of high pollution? If so, research the area and identify what health patterns are associated with this. Yes, you can do research and you should do research. So that way you can help educate the patient and empower them with information. During the needs assessment, evaluate the immediate environment in which the patient lives. Survey their home. This includes looking at the overall condition of the home. Where is the home located? How close is the home to a healthcare facility? Does the home have clean water? Does the potential exist for contamination of that water? Does the home appear to be structurally sound? Is the house well insulated, or does it feel drafty? Could the house contain asbestos or lead paints? The presence of lead paint is a greater possibility for houses that are built before 1978. In regard to documentation, it provides the foundation for the development of treatment plans, and it serves as a means to evaluate and improve upon those plans. So what I put up here on this slide is an example of our documentation as it relates to identifying social determinants of health. And this is in our MIH goal plan. So when one of our mobile health paramedics goes into a patient's home, they identify what program they're enrolled in, and they say, okay, there is a need for education. So they mark the disease education, they put in some further details. And for example, with this particular example, the patient needed a referral to a specialist, a pulmonologist. We also have them document, is this pending? Is it in progress? Is it closed? Because that way, for each subsequent visit, they're going to go in and update that note until we close out. So that's why we look at not only identifying gaps for the patient as it relates to social determinants, but we want to make sure that we are navigating these patients to the appropriate resource. So we're also tracking that. So if let's say, for example, 10 patients came into the program and only 50% of them were navigated to resources, well, what's the issue? Why aren't we navigating 100% of those patients to resources? Is it because there's a lack of resources? And then we need to further look into, is there some other issues with the social determinants of health for the population that we're serving? Several public health initiatives have been enacted in an effort to address health disparities. Initiatives at the local level include public health education regarding safe sex and abstinence to address sexually transmitted diseases, free blood pressure and diabetic screenings, classes on proper diet and exercise. We're blessed here in the Fort Worth area. Our food bank is amazing. Not only do they have food banks and a great hub, they also have cooking classes. When you go to their main headquarters, they have a garden literally out in their parking lot. So they're an amazing resource, not only providing food, but offering classes on proper diet and exercise. Policy initiatives to address the social determinants of health at an early age have included nutrition, school nutrition programs, drug education programs, continuance of physical education in schools, and increased focus on literacy level. At a broader societal level, initiatives such as unemployment benefits and low-cost healthcare clinics have been established to address the social dimension of health and help people gain access to healthcare services that they might not have otherwise been able to access. One of the most recent and well-known initiatives is the Patient Protection and Affordable Care Act of 2010. This attempt at a major overhaul of the healthcare system, shifting from quantity to quality, focuses on making health insurance and access to healthcare available to virtually all members of society. While some aspects of the laws have resulted in increased access to care for some patients, other patients have been negatively impacted, however. But be aware that some patients who had access to care prior to the Affordable Care Act lost access to important aspects of their health care that were previously afforded to them. So overall, we know that understanding and addressing the social determinants of health has made an impact on our society, and I promise you it will make an impact on the patients that you serve.